right, we're live now. Yeah, so we're just gonna wait for a couple of minutes for people to join.
Sure. All right, I'll be upstairs. Okay, Aaron, a little bit. I'll come upstairs. I'll come upstairs. I'll be done. I'll come upstairs. Mm-hmm. Yeah, handsome. Soon. We're just waiting, and then Maddie will start. I can wait for some more people. Yeah. I'm okay with that. Thanks for asking. What? I see that.
Okay, we can begin. All right, welcome everybody. This is Dr. Deep Shah, and he is a board-certified pediatric dentist. So take it away, Dr. Shah.
All right, thanks guys. First of all, to you and like the crew, thanks so much for having me and for giving me the ability to talk tonight to all you guys. So my goal today is to talk about the world of pediatric dentistry, because that's what I am, a pediatric dentist. So just to go over my journey and kind of what I do and why I love the field and why I think it's fascinating. So a little bit about me, I guess, in terms of my introduction and background. First and foremost, I'm a husband. I'm a father of two awesome boys, 3.5 and 18 months. And I have a golden doodle named Burfy. So he's 4. And so between all of us, we just love to have a lot of fun in between, obviously, work. But when I come home, it's like phones aside and spend as much time as I can with them. On the time off, I love sports, traveling, reading, just the kind of things to unwind. And then a fun fact for me is that I've danced competitively throughout undergrad and dental school. And so that's something that I have like a side hobby or side passion in. So now in terms of my professional life, I'm kind of on both ends of like the spectrum. So I'm in a private practice setting right now in Exton, Pennsylvania, which is in the suburbs of Philadelphia. And then I'm also in academia. So I'm an attending at Penn Dental Medicine and CHOP, which is Children's Hospital of Philadelphia. And so I'm able to work with the residents in the academia sector and help them grow, and at the same time learn and grow myself. So in terms of the educational background and kind of my credentials, for undergrad, I went to Drexel University, which is in Philadelphia. Following completion of my biology, I got a major in biology there, along with a minor in business administration. And then on completion of my 4 years there, I went to dental school at the University of Pennsylvania. So literally just jumped, hop, skip right across the street to Penn. I was there for 4 years. And then at the culmination of my dental school, I ended up going to my pediatric residency. I decided my third year of dental school that, hey, I really like peds. I really want to pursue it. And I got accepted at Children's Hospital of Pittsburgh of UPMC out in Pittsburgh, Pennsylvania. And that's where I did 2 years of my residency at a hospital-based program out there. And then I've been practicing since August of 2015. So 5 years under my belt. And that's kind of where I am at this stage of my life. So a little bit in terms of a day in the life of being a pediatric dentist, or a day in the life of me. Every pediatric dentist's life is going to be a little bit different. But for me, just to give you guys a little insight in terms of kind of the dual life, I like to call it. So in terms of private practice, I absolutely love my lifestyle. My hours are great. 7:30 I start. I'm done by 3:30. So by the time I'm home, it's like 4:15, 4:30. My mornings usually entail having a couple of cases of oral conscious sedation. And so oral sedations are, so if you break down oral conscious sedation, oral meaning I give a child medication orally, so they drink it. Conscious meaning that the child's awake throughout the procedure, but they are sedated. So they're a little bit in an altered state of mind or in a twilight state. So these different medicines that I use, your combination of different medicines, help to take a child who either is not cooperative or who just has a little bit of dental phobia or anxiety or just has a lot of work for various situations, and just helps them to withstand treatment a lot better. And so my mornings consist of those. And I see a full array of treatment. So a lot of people think of the dentist, they think of, oh, fillings and cavity. And yes, that is a part of it, but there's just so much more that comes with the field. You have your fillings, you have crowns, there's extractions. And one of the biggest things that I do, and I have a niche in, is the use of lasers. And one of the case studies I'll talk about coming up shortly will be in terms of using the laser and how useful it is and kind of the functions of it. So a normal day in private practice, I run one column. So an op is like operative procedure. So I run one column of operative procedures. That includes like your fillings, extractions, doing different crowns, different type of dental procedures, so to speak. And I'll see about 10 to 15 patients, roughly. Now, alongside with that, I have hygienists, and my hygienists are cleaning the kids' teeth. I go in to do hygiene checks, and I run about 3 columns of hygiene. So for each hygienist, they roughly see about 15 to 18 patients a day, and I have 3 of them. So roughly I'm looking at like that 45, 50 patients ballpark in terms of the hygiene. You combine that together, roughly about 60 to 65 patients a day that I see. I do something called IV sedations in the office. Now, you guys have probably heard of general anesthesia. For those of you, familiar with the medical lingo, this is very similar to general anesthesia, where the kids are fully asleep. But instead of being in a hospital setting, I actually have a dental anesthesiologist who comes to the dental office, and we do this right then and there. The biggest difference here is that instead of the child being intubated and having like a breathing tube kind of down their throat, so to speak, these children are breathing on their own. So the recovery is a lot quicker, and I can just see a little bit more. My case volume is a little bit higher. So it allows me to be a little bit more efficacious and speedy in terms of my treatment time. So I do that about every 3 to 4 weeks. We start like at 6 a.m. in the morning. I'll see about 5, 6 cases. We wrap up around 3 in the afternoon. But it's a great way to treat kids who otherwise cannot sit in the dental chair, or who are just too young to comprehend, or might even have some type of medical condition that prevents them from sitting in the chair. And then the other thing here is that I'm currently in the process of becoming a clinical director for the company, which I'm very excited about. And so that role will expand, and that might include me traveling to various states where we have offices, and just overseeing management and making sure our protocol at these offices are all lined up, and maybe going to an office where certain things are not set up and maybe establishing an oral sedation protocol at an office, for example. So that's a new role that I'll be taking on, which I'm very, very eager and excited for. So that right there kind of sums up my life in terms of private practice. In the academia setting, a little bit different. The hours can be a little bit longer. So my Mondays, I work 2 Mondays a month. Those are 8 to 5, 8 a.m. to 5 p.m. And then I work every Friday, and that's from like usually 7 a.m. to about noon. So my Fridays are great. I kind of get done having a half day there. As an attending at Penn, my role and responsibility predominantly revolves around the pediatric dental residents who are there, so the first and second year residents. So on Friday mornings, I help and like kind of oversee the literature review. So we do lit review from 7 to 8 for an hour, talk about articles. Sometimes I'll give presentations on various topics within dentistry. And the whole goal here is just to kind of expose and learn more about the field. Now, I also run the oral conscious sedation program. So I have a niche with, like I said, with the sedation and the laser. So what I do for them is run their oral sedation program. So I work with the residents in the morning. We see a couple of patients, and they learn how to manage the airway. They learn about pharmacological interventions, what drugs to use, why to use them on a child, what the outcome will be, what to do if things ever go south, and how to reverse certain situations. Luckily, we haven't had that. But it's all kind of part of the scope of what that entails. And then, like I said, my work focuses predominantly with the residents, but there are some afternoons, especially the Monday afternoons, where I'll work with the dental students, the 3rd and 4th year dental students, and that's a lot of fun as well. So that's just a little bit, I guess, in terms of the day in the life of me and what I do. We'll jump right into the case presentations, because I think these are interesting. Now, the one thing, like I said, dentistry is when people think of dentistry, they think of cookie cutter stuff. But this is a case I really wanted to talk about, because this was one of the probably the most emotional case that I was able to see, and I'm so blessed to make a difference in. But I had an 8-year-old healthy male who presented with his father for a routine cleaning. There was no major health concern. They were seen by another provider before they saw me. And upon my examination, I see this kid here. And if you look at his tongue, he's sticking his tongue down. But you kind of see how the proclination of that tongue, it's kind of coming down. So when you stick your tongue out, you should be able to stick your tongue out. It's flat and straight. When he stuck his tongue out, it kind of drooped and kind of went down. And so this is really neat. And I'll have you guys who are following along, you guys can do some experiments with me as I talk about this, because you'll realize how important the tongue is in terms of the airway and also in terms of speech. So your phonation and dictation. And so what the story here was that I was talking to Dad, and his dad got very emotional and teary, and he was saying that nobody understands this kid at home. When he talks, everyone keeps telling him, "Huh? Can you say that again?" To the point where he was like, "I hate my family. I don't want to live, and I hate everybody. I hate everything." And it's almost like it's one of those things you hear, and you're like, "Whoa, this is huge." This is psychology involved. This is mental health. He was getting bullied at school. So this is a lot of factors affecting a kid who's 8. And all of us who are out there listening to this, who you are right now is shaped by your childhood. And the person you are right now, a lot of things that have happened in your childhood factor into your personality, your experiences, what makes you you at this present moment. So you can kind of see the trajectory or path that this kid was headed down. So I did an analysis. And like I said, to me, dentistry is great. There's great things you can do with the teeth, but it's more than just the teeth. We took a look at his tongue, and this kid was tongue-tied, and so which was really affecting his speech. And I'm going to go over here to the next slide. Excuse me, I got a little bit of a sore throat. But we ended up doing a laser phoneectomy on him. So I'm going to show you this video here. So one of the things I use is a laser. Pretty much we isolated his tongue. In front of him is a little bit of tissue. He's got this tissue that kind of hangs out underneath the bottom of his tongue, and it connects to the floor of his mouth. And what I'm doing there with the laser, I'm using heat to cauterize the tissue and to no longer have that attachment, so his tongue is free, and he's able to move his tongue around and have free mobility of his tongue. And as a result, hopefully have improved speech. Now, as you guys are watching, you can kind of see that diamond-shaped cut right there. You kind of see a little hole in the middle. It almost looks like a diamond-shaped cut. That's kind of how you want that release to look like.
You doing okay?
And this
Awesome
kid
job,
walked in.
Nancy.
I did get him numb. I gave him a little bit of local anesthesia underneath the tongue. But this is just kind of show you how this procedure works. Usually this will take me about 30 minutes in the office setting.
Right, we can get that
We're done here.
bit.
I did this a little bit longer just so you guys can see. But the one thing I want you guys to do right now when you're watching this at home, close your mouth and swallow. And I'll ask you, where does your tongue reside? Where is the natural home of your tongue? It's the roof of your mouth. A lot of these kids who have a tongue tie, when they're at night, a lot of them might snore or they might mouth breathe because their tongue, that attachment is too strong. So it pulls their entire tongue down. And so instead of sleeping with their mouth closed, you end up getting one of these as the night goes on. And mouth breathing. Mouth breathing also dries out the mouth. Sometimes you get cavities associated with it. But in terms of the tongue, it really impedes the ability of nitric oxide being released from the nose, which is a key factor in terms of vasodilation, especially at night. So here's a picture before and after. So there is that attachment that he had on the left. You can kind of see it starts kind of at the underneath, like the border of the tongue, hits the floor of the mouth, and it kind of attaches right behind his two front teeth. And so what we did there was just to remove that tissue so he's able to stick his tongue out a little bit more and give him full range of motion. Now, the next slide here, I'm going to show you a couple of different pictures here. I'm going to go over different stages of a frenum that you might see. So there's two types of ties. The most common usually is a tongue tie because that's the one that typically impedes with feeding and also speech. But you can also have an upper lip tie, especially in little infants who are having a hard time feeding. So there's three stages to catch this. One is when a child is very young. So from a couple weeks old to a couple, into being a couple or several months old. What you'll notice there is that both the infant and the mother are having a hard time with feeding, which is the essence of life for a baby. In terms of a baby, they're going to have a hard time really suckling on and latching on to a nipple, whether it's the mother's breast or into a nipple of the bottle. And so these kids will constantly go as they're suckling their milk. They're constantly drooling, or they eat for like 5-10 minutes. They're full, they get very gassy, and then next thing you know, 15 minutes later, they're hungry again. So you get these cluster feedings, and it happens around the clock, non-stop. If you're a mom, you're not getting any sleep, and it's really, really, really mentally exhausting, and you feel like you're to blame. And it's not you, it could just be the anatomy of the child. Now, if you're a mom, you might get, and if you're breastfeeding, it's usually not fun. Either you have like very painful nipples or bleeding nipples, you can get cracked and sore nipples. And you can get mastitis, which is inflammation of the breast tissue, and get kind of, it's hard to drain that breast milk, and it can lead to fever and overall malaise, and it's just you're not feeling very, very well. So these are all the things that sometimes are associated with improper feeding. So when you're able to do that, like a picture I have on the bottom right is actually a child who had an upper lip tie, and you can kind of see how white that tissue is on the picture with the thumb that's pushing up. And then when you release the frenum, that child upper lip has just a lot more mobility. So they're able to take that upper lip and put it over the mother's breast or even on the bottle, and you get a much better latch. So it's all about quality of life. So that's the first thing that you're going to see in terms of the infant stage. Now, let's say the child was tongue-tied as an infant, but was able to feed okay. The next thing you may see something is when they're school age, like I showed you in that video before, that kid was school age. Here, it's a very more prominent. The biggest thing you're going to see here, obviously, they're done with their feeding stages in life, but now you're going to start seeing speech, phonation, dictation, and even sleep can be an issue. The tongue plays a huge role in terms of cleansing, having full range of motion, speech, and sleep. So if you take your tongue, you should be able to take your tongue and go all the way around your mouth. We have our fingers, but our fingers aren't meant to go in and clean our food. Our tongue should be able to do that for us. So the tongue plays such an important role in terms of going over and sweeping our buccal vestibule. So you should be able to take your tongue and naturally sweep it all across your mouth. Kids who are severely tied can't do that. And so that's another reason why, assessing a tie is so important. Certain sounds that you're going to hear. Kids who are severely tied, they can't say certain words like thunder, or rabbit, or the L words or some of the S words. So for example, instead of saying thunder or 30, 31, 32, 33, where that tongue has to touch the tip of the upper teeth, you're going to have them say funder, furdy, 31, 32, furdy flea, it gets substituted with an F. Same thing with the R's. So if you say Roger Rabbit or Rolling Rapids, these kids are going to say Roger Wabbit, Rolling Rapids. So you get a W. And sometimes, like I said, I'm exaggerating this, but sometimes it's really not that exaggerated in real life. These kids will really talk like that, or there'll be a little bit of a subtle change in their speech, but it's something that their parents know right off the bat. And the last stage is that if you're an adolescent and if you have a severe tie, you'll notice as you get older, it can affect, you can get something called sleep disorder breathing. It can lead to bruxism or nighttime grinding. And the worst thing that can happen is as you age and get older, into your 40s, 50s, and 60s, as you lose muscle tone, you can have like obstructive sleep apnea. You could be on a CPAP and things like that. And so obviously these are things that start in the oral cavity, but as you can tell, can have a manifestation to the rest of the body, which is why it's so important to catch this. Because I always say the mouth is the gateway to the rest of the body. So dentistry is cool in terms that, yeah, there's awesome things. I'll show you some slides on teeth, but this is one of the most powerful examples I can show you guys that it goes beyond teeth and also tongue and airway. So here's just a couple of pictures. On the bottom left, you can see a child who was trying to stick his tongue out. And then post-operative, after the surgery, he stick his tongue out, and you can kind of see the difference. You can almost stick his tongue out double the amount. What's up, Ori? Hope you don't mind my little guy. He's hanging out with me. And then the other thing here is you can kind of see the surgical site in the picture in the middle. And then about 2 weeks after is when I usually like to do my follow-ups. You can kind of see that white little button. Looks like a button that you'd have on a shirt. That's kind of the healing site. So that's a normal healing. Sometimes it looks like it's white. It can look like there's pus or infection. But there's no pus or infection. And then, like I said, there's the picture on the top left, on the top right up there, shows a picture of an upper frenum that I did on an older child. And so here's a beautiful example. All of this right here was done with a laser. It's really minimally painful in terms of invasiveness, like very minimally invasive. There's no stitches or sutures I need to place or put, which is phenomenal. And the recovery, as you can tell, is great. And at the end of the day, it's really life-changing. So that's my first case and the longest one. Second case here just talks about orthodontic exposure. So as a pediatric dentist, one of the things I do is I have an orthodontist that I work with. And this is one of the cases that we combined and we did a co-case. So this girl right here was a 13-year-old. Her canine on her upper left was impacted. So it just wouldn't come in. And what we had to do was we had to expose that tooth. So I used the laser. I cut out a little hole in the tissue. If you follow the arrows, it's kind of chronological order in terms of how things were done. And I think from the first picture to the very last picture, we're looking at about 5 months. But then what the orthodontist did right then and there was put a little bracket or a metal bracket on the tooth and then put a little rubber band that hooks onto the coil on the braces. And what you're doing here is you're trying to use extrusive forces to help pull that tooth down into the arch. Now you can see on that second to last picture, that tooth has come in nicely. And at the very last picture there, you can see where that tooth was and where it is now. Now there's a little bit of kind of like the tissue around there is a little bit tender and sore. So that patient might need to see like a periodontist for a free flap just to help kind of the tissue heal in that area. But from where we were to where we have gotten, that's huge in terms of this child's orthodontic care. So I thought that was a neat case to show you guys that there is a very interdisciplinary approach with pediatrics where you can work with other disciplines to achieve a maximum outcome. Case 3 here is something I call the complete oral rehabilitation. So I do this. These are my IV sedation days where I have the anesthesiologist come in. And these are kids, like I said, who are put to sleep, and we do a bunch of work. What I wanted to depict and really show here was how this child has decay, baby bottle decay here in the front. And what we were able to do was put these nice white porcelain crowns for this child. And so sometimes in the back, you put silver caps or silver crowns. In a case like this child, aesthetics, especially no matter where you go, people want to see white. They want white crowns, white teeth. So the one good thing with the way that the field is moving, you have a lot of different options. So these crowns here are kind of like porcelain. The back of them, which you can't see, have a little bit of a stainless steel or a silver backing for strength. But we also do all white crowns as well, even for the back teeth. That's an option as well for a lot of patients who don't want any silver in the mouth. So it's kind of neat in terms of where dentistry was 10 years ago and where it's progressing, especially in terms of aesthetics. So once again, the reason we went this route was that this child is 4. Her medical history was non-contributory. She was healthy, but she was at a high caries risk. Front 6 teeth. She had a couple teeth in the back as well, which you can't see. Her behavior was not great. We were unable to take x-rays in the dental chair. So we had to sedate her, take x-rays, and then do all the work while she was asleep. So that's an example of like a complete oral dental rehabilitation case. And last but not least, extractions. I get a lot of these extraction orders from the orthodontist, or if a tooth comes in and, you know, the adult tooth, we're waiting for the adult tooth to come in, and the baby tooth is hanging in there. These I thought were a little bit more fun. It's something called an ankylosed tooth, so where the tooth is actually fused to the bone. So that picture on the bottom left with the kind of the x-ray, you can see like this, that where the pointer is, that tooth was in there. That tooth does not have an adult tooth, but the orthodontist wanted to remove that tooth to help the child's bite and bring them into a better occlusion. And occlusion is just the way you bite down. And so that second picture is the tooth that came out in one piece. But one of the coolest cases I just did a few months ago was that one on the right, where you can see how there's almost like a step ladder in terms of the bite. So anytime you see a step ladder, usually that, you know, the baby tooth is ankylosed or it's fused. So it was a little bit of a challenging case, but it was really cool. I'm really neat. I was able to get that picture of that entire tooth without breaking the root. But this is like your basic kind of extraction case. Not necessarily basic, but a little bit more advanced. But it kind of shows you that, hey, these are also things that fall within our realm in terms of being a pediatric dentist. Even though I work with an orthodontist, there's a lot of orthodontists in the area, and I'll get a lot of referrals from them in terms of, you know, extracting teeth so that the child can go back to the orthodontist and start their, you know, Invisalign treatment or start their conventional braces therapy. And so that's my case right there. So that wraps up my cases. And just to kind of wrap things up in terms of kind of bringing everything back home again one more time. I personally find dentistry to be super rewarding. I think anything in healthcare, honestly, is super rewarding. But for me, what I really loved about dentistry is that the personal and financial freedom. You're going to do very well. You're very well off. And sure, money is a part of everything just because we have loans to pay. Everyone is always, you know, wants to see the bottom line. So sure, I absolutely understand that money and financial freedom play a big role in it. And you will get that with dentistry, but it's not the end all be all. In my opinion, the personal life is great. I have so much time to spend home, you know, with my boys, with my family, to take vacations, to travel, and just ultimately live a very complete life, right? I always tell people when you're applying to school, you want to have a very balanced resume, right? That's what everyone strives for. Well, why not translate that into your professional life? Why not have a very balanced professional life? And I think dentistry is one of the professions that really lets you do that, and I really love it. One of the biggest things I say here is where everyone here, like I said, especially if you are applying to med school or dental school or pharmacy school, any grad school, resumes are important. Everyone's trying to do the best they can, try to get a 4.0, try to research, try to get ahead. And all that's great. You know, I said, you want to do well, you want to work hard, and you want to see the fruits of your labor being rewarded. But at the end of the day, just remember that I have never, ever, ever had a patient ask me what my high school, college, dental school GPA was, ever. Remember these 3 A's. I call them my 3 A's. It's affability, availability, and ability. And patients are going to measure you in order of those 3 A's. If you're affable, if you can have empathy and relate to them, that's the most important thing. Are you available? Can you squeeze them into your schedule? You know, that's important. And then last but not least is your ability. Sure, what you do and how good you are absolutely matters, but it's not the first thing people look at. So if you are really good at what you do, and you have a great personality and you're able to squeeze them in, I mean, that's like hitting a home run, and it goes in that order. So just remember those 3 A's. So what I always say is build your life resume, work hard, but have experiences. And to me, as someone who is on a panel for like residency interviews that start tomorrow here at Penn, that's what I look for. I'm great. If I see a candidate who has a 3.6 and a 4.0, to me, that's like, okay, you guys, you've made it this far. What have you done that differentiates you from the rest of the crowd? And what I want to see is your life resume. What's something interesting, different, unique? Are you following your passions? What is your why? You know, why are you going into medicine? Why are you going into dentistry? Is it because your parents are forcing you and telling you, hey, this is what society expects of you? That's not your why. That's their why. Find your why. And I love it. I love talking to you guys because I feel like this is the generation that really understands and gets that, and they really follow their decision and follow their choices. But just remember that if you always have a why and purpose and intent, you'll never go wrong in life. And so that's one of my biggest takeaways. You're all going to fail at some point in life. I failed in dental school. I failed a class. It's part of life. I don't know anyone that's ever succeeded without failing. Warren Buffett didn't make as much money until he lost money. I mean, it's same thing in the financial world. All these people that we admire and respect, from Michael Jordan, LeBron James in the sports world to like Elon Musk, Warren Buffett, these guys have failed in their respective fields. And it's only through those failures have they persevered and become better versions of themselves, and ultimately have become better professionals and successful. So just remember that there's a silver lining in every situation. Don't kill yourself about a B or a C that you got. 10 years down the road, you're going to look at it. You're literally going to go, you're going to laugh about it. And you're not going to care about it because it really doesn't matter in the end game of life. So my thing, like I said, on Instagram, I'm the superhero dentist. And I always say my quote line is, be your own superhero. There's only one you in this world. So why not live your life to your potential and the way you want to live it? Be your own superhero. Create your own path and follow that path to the best of your ability. And last but not least, always be kind, be grateful, and just love unconditionally. There's a lot of hate, there's a lot of jealousy, there's a lot of ego, envy out in the world. But if you surround yourself with people who are loving and caring and you embrace those values, the world's going to show you everything else. But the world won't show you that pure love at times. So just be grateful for where you are. Don't sweat the little things. And just like I said, live life and enjoy life. I always say life is not short. Life is not long. Life is finite. There's a beginning and there's an end. And what you do in that moment and in that time period is what defines you and your character. And like I said, at the end of the day, I know all of you guys are trying to do your best to get into grad school and you guys are working your butt off, but don't worry about the GPA. I said this in my last interview that I did. If one of you can find me a patient or a person who's died with their GPA and their like CV on their tombstone, I'll give you $1,000. Like, I haven't seen it anywhere. And so that really shows you that nobody cares about your credentials and the numbers. They care about the empathy. They care about the people that you've touched, how you've impacted people. And that's the most important thing that matters in life. And so that's just my insight in terms of if there's any wisdom that I can give you guys. So thank you so much for giving me this ability to talk to you guys and kind of shedding some light in terms of pediatric dental realm. I'll leave the floor open, like to questions. Those are just a picture of my lovely family who I just really cherish, love, and adore. And to me, like I said, this is what life is about. It's just about creating the best life that you can and cherishing it and loving it and surrounding yourself with people you love. With that being said, questions, feel free. I can't see them because I'm not on the YouTube live here, but
yeah, they should be in the chat area.
Oh yeah, let me escape this. Let me get it into the chat room. All right, let's see. Stop share. Here we go. Chat up. All right, here we go. Thank you. Let me scroll all the way up. All right, cool questions. All right, what made you choose dentistry over internal medicine through an MD program or any other specialty? What is a typical day like as a pediatric dentist? I went over that. Why'd you choose pediatric dentistry? All right, so my story, guys. All right, I had ALL, which is acute lymphoblastic leukemia, at the age of 2. So I was diagnosed that with the age of 2. I've been in remission since the age of 5. So I turned 34 on Thursday. So it's been like 29 years I'll be in remission. So I'm blessed to have like this so-called second chance in life. Luckily for me, I did not go through chemotherapy. I did not go through any radiation. I responded to a medication called methotrexate. And I responded very well to that medication. Some of the side effects were being very moon-faced and chubby as a child. But if that was the least of my concerns, I would have taken that any day over some of these kids who were totally shaved heads, had IVs, and all of these things going on with them. Could probably never reproduce some of them again just because of how much chemotherapy and radiation they've undergone. And so as I got older and I went back to visit my oncologist, I would see these kids hooked up to the IV pole. And you would think that, hey, like, you're hooked up to an IV, you have no hair, you're really thin and frail, you're really miserable. And it was the complete opposite. These kids were like in their safe haven. They were so happy. They were playing video games. They were like honestly, it felt like angels on earth, and they were some of the most happiest kids I've met. And as I became a teenager into my adolescence, I realized that, wow, like kids are like a clean slate, and the way you paint on them or the way you draw on them really helps to mold them into who they're going to become 5, 10, 15, 20 years down the road. Think about where you were in life and how much your childhood, the good, the bad, the trauma that you may have gone through, has impacted you to this day. And so when I came to that realization, I realized I really wanted to work with kids. So that's kind of my long drawn out answer in terms of kids. Now, dentistry, I've always been ambidextrous. I personally love instant gratification. So the ability to deliver a smile right off the bat, to get a kid out of pain, and to create something with my hands and be nifty with it, is kind of what led me to dentistry. And when you combine both of those worlds together, hence pediatric dentistry. So that's kind of my story and my personal story there. The other questions I answer, I think the typical day, and then why I chose pediatric dentistry, I just answered that. What was your pediatric residency experience like? What was difficult about pursuing pediatric dentistry? Yeah, my pediatric dentistry residency was phenomenal. I'd go back to residency in a heartbeat. So I studied, or I should say I did my residency at Children's Hospital of Pittsburgh of UPMC. I had some incredible mentors. My top 3 attendings there were like in their late 30s, and they were just brilliant. They would push us. Being in the hospital, I worked very closely with ENT, with plastics, with hemonc. I mean, we'd see kids, of all different ailments, and it really expanded my horizon. So a lot of people like, oh, you're a dentist, and like, sure, like, in terms of dentistry, I'm a dentist, but internally I call myself like, I think I consider myself almost like an MD, because I know like my medications, I know what medications to give a child, the various different, ailments out there, how it affects, kids, what to look forward to, how to change your behavioral modification based on if someone comes in with Down syndrome, if someone has cancer, or they had ALL, what blood values and what values am I looking for? And those are all things that we were taught in residency, being a hospital residency. So it was a little bit more than your cookie cutter bread and butter dentistry. So I'm really proud to say I went to a program that really taught me to be a complete physician and not just looking at teeth. And so I'm very, very proud of that. But that's like I said, do a lot of different things that I've learned, especially from ENT and airway assessment, that I still do to this day to catch airway issues. Because at the end of the day, what keeps you alive is how you breathe. And if you can catch, like I said, things early in a child, like that lingual frenectomy or an upper frenectomy, if you can catch and see that a child isn't functioning to the best of their ability, you're not just doing dentistry, you're doing something that's life-changing and life-altering. And so that's what I really like the most. What's difficult about pursuing pediatric dentistry? It was just competitive. I think that's kind of the biggest thing, is that everyone wants to go into it at a certain point. Like, it's just kind of, you try not to, but you're also trying to measure yourself against other people. It's a very competitive field, but all you can do is just put your best foot forward. You really can't worry about others. But I think that the biggest thing here in medicine is that more and more people are trying to go into it. And it's just that double guessing. Am I good enough? Am I good enough? And I'm saying this as someone who's gone through it. And so I can understand, because I've been in your shoes, but you are good enough. And at one point, you're not going to sweat over the small things. But I think that was a difficult part, is trying to, you can psych yourself out very easily. Just don't let it happen to you, because look at the long picture. Next question here is, how is pediatric dentistry different than adult dentistry? Is it more difficult to work with children compared to adults? How do you adapt your approach when working with children? Was pediatric dentistry always your primary interest? Awesome question. Let's break this down question by question. So how is it different than adult dentistry? So here we're working with kids. So there's a lot of behavioral modifications. Cool thing here, and for those of you who are maybe pursuing psychology or know a little bit about psychology and psychiatry, in a child, the frontal cortex is not developed. So if you're trying to reason and rationalize with a 4-year-old, good luck. Like, you're not going to be able to tell them to sit still and, little Johnny, here, put your hand up, open wide, do this. Like, their attention span is limited. Their frontal cortex, their amygdala, all that stuff is still developing. And for many of us out there, like I said, you actually don't fully develop your frontal cortex until you're about 26 years old. So many of you out there are still developing that frontal cortex, which is why, like I say, they say when you're in your late teens and early 20s, you do stupid things. I've been there too. We all do it. It's just because that frontal cortex is still differentiating in terms of right versus wrong and making more educated and like kind of sound decisions, if that makes sense. So we've all been there, and some of us are still there, and that's totally fine. That's the part of the process. And if you take that to a child and you're trying to do dental work, the attention span is very different. The airway is very different. The size of the airway is very, very different. So a child is not a small adult. Their entire circulatory system, their airway, their mechanism of how they function, their blood volume, and just like overall lung capacity, everything's totally different. And there's no just like, oh, adult here, this kid's here, oh, it's like a 10 times full. Every kid's different based on their BMI and things like that. So it presents its own challenge in terms of that. So they're not a little adult, but they're their own little human beings with their own challenges, and attention span. Now, is it more difficult to work with children compared to adults? Yes and no. There's a lot more behavioral modifications. Like I said, you can't really rationale with a kid. So I'm seeing a lot of Frozen songs. I think I know my Disney movies like the back of my hand. So you're doing like a lot of like putting in the work in different ways. But you're almost like you have to bring the energy 110% with every kid. So I could go into a room, have a kid that just drove me nuts. I can't take that energy and me being depleted and exhausted with my next patient and be like, hey, what's up, man? Like, how are you? Because you're going to feed off that energy. So you have to bring that A game for each and every kid and bring that passion. And that's the best thing. So that's in that sense, I think it's a little bit more difficult because you just got to leave the baggage. You leave the baggage in the room and you open up a new bag when you get to the next room. So I don't find it to be difficult. I think it's fun. It keeps me on my toes. But for people who are like general dentists, they do ask, like, how the hell do you work with kids? And it's like I said, it's one of those things where you got to have the passion and the purpose for it. How do you adapt your approach when working with children? So for me, it's like I said, I'm a big on superheroes. Every day I go to work wearing a different superhero shirt with a matching mask and a matching scrub cap. And so my whole theme, like I said, is to empower kids to be their own superhero. I do have Frozen stuff, but at the end of the day, my approach is to make this child feel like they're the most special child in that chair. And there's nothing that they cannot do. And, sometimes it takes a little bit more time, especially with the younger kids. But hey, it's all about letting them grow and just realizing they're kids. They're going to have good days. And some kids are great. The next time they come in, they throw you a complete curveball and they're not so good anymore. But that's the beauty of being a kid. You're allowed to act and behave the way you want to behave because you're growing and you're learning. And then was pediatric dentistry always my primary interest? No, I think I was big. Initially, I grew up like I want to be a neurologist and neurosurgeon. I have no idea why. Probably just social stigmas and social pressures, honestly. And then when I went to dentistry, I was like oral surgery. Like I love surgery. But I think I realized like I just didn't have the personality to be an oral surgeon. And a lot of people told me that. I'm really, really lucky that the residency program I went to, I did a lot of oral surgery. So a lot of flaps and like raising, digging for teeth and really going after, teeth in the bone, doing free flaps, doing marsupializations and all these different procedures, wisdom teeth extraction. So I got a really good base of oral surgery, which I'm really happy about that I'm able to utilize in my practice right now. But yeah, I would say in terms of dentistry, pediatric dentistry was probably my second choice. And oral surgery was definitely something that I was interested in from the get-go. Great question. What are some of the challenges you faced at work that have helped you grow as a dentist? What is the difference between pediatric dentist and a family dentist? So in terms of challenges that have faced me grow, challenges that I faced at work that have helped me grow, I think the great one here is where I work right now. I work in a very like a very white collared area. And so some of these parents come in and they're very posh, they're very entitled. And I think you just have to be respectful. I really learned to curb my ego. We all come out of med school, dental school, and like you think you're going out there and changing the world. And it's great to have that feeling, but it's also realizing that, hey, like just have empathy. And if a mom comes in and she's upset, like just try and understand her. Like you're the professional here. We all took like a Hippocratic oath to do no harm. But a lot of the things that we also forget is we always, sometimes dentists get the superiority complex. We're like, or I should say healthcare professionals, not just dentists, but MDs, anyone. Like, I'm the doctor in charge here. How dare you talk to me that way? And at the end of the day, if you just come from empathy and from love and reason, you really try to get to connect with individuals on a human to human connection, you really learn to grow. And I think those are some of the hardest, I think that's really helped me. Is the challenges on it when a patient that comes in who's unhappy, or if I get a child that's very difficult, and how I react to that child can either make or break the appointment. I think I've learned and grown from a lot of those situations and circumstances. And then what's the difference between pediatric dentists and family dentists? Pediatric dentists are specialized in, airway assessment, from pharmacological intervention to behavioral management, to treatment modalities, and kind of the landscape of what we do compared to a general dentist or a family dentist. We undergo 2 years of specialized training to learn of all these things and the growth and development of a child. A family dentist can certainly treat kids, but their breadth and their landscape and knowledge of other issues may not be there. So a lot of these times, these general dentists or family dentists will see children as long as these kids are quote unquote good. And a lot of the times, if they feel like, oh, there's something that's more complex that needs to be done, or the child is just not cooperating to their likelihood, they'll refer them out. So that's kind of answers that question. When you apply for a residency in dentistry, do you get matched like you do with MD/DO? What made you want to do specifically pediatric dentistry? I did already answer why I wanted to specifically do pediatric dentistry. And then, do you treat dental caries in cases of odonogenic infection? It's a great question here. So when you apply for residency in dentistry, do you get matched like you do? Yeah, you do get matched. The cool thing here is when you're applying to residency, the system favors you. And I think it's the same way in terms of MD and DO. So you're going to rank, you'll apply. And I think this applies to anything in dentistry, whether you're doing pediatrics, whether you're doing oral surgery, whether you're doing orthodontics, endodontics, periodontist, anything like that. You finally, once in your life, I guess, you get preference in terms of where you want to go. So when you make your rank list, it prioritizes your top choice. And so it favors you as the applicant. And then do you treat dental caries in cases of odonogenic infection? So if a child comes in with an odonogenic infection, the goal of that visit is definitely to take care of that tooth that's abscessed or has the infection. And for that day, get that tooth out as soon as we can. Sometimes we may have to give antibiotics, especially if you have like a pretty big facial cellulitis. That there's a lot of bacterial overflow. It's a pH balance. So if you give your local anesthesia in that area, it just may not be efficacious because the bacterial load is so high that your anesthetic is not going to really counterbalance that. So in cases like that, we may give an antibiotic to help subdue and bring down the number of bacteria, and then go in a few days later and kind of get the area numb and take that tooth out. The goal here obviously is to look at the mouth as a whole thing. So we're not just going to go in and, hey, mom, like, we just want to take this tooth out and you're fine. If there's other things that we see, we do want to bring it up to the parents' attention and let them know, hey, your child should also probably get scheduled to come back for X, Y, and Z. But today we definitely want to get them out of pain. So we're going to take care of, the situation. But there is some other outstanding treatment that we need to do. And we need to treat your kid as a whole and take care of everything and not just one issue at a time. Otherwise, they'll be coming back every couple of months for taking a tooth out. And then you lose space and it becomes a whole lot of other issues and a whirlwind of issues. Next question here. What are some memorable experiences with patients or in general as a peds dentist? So I've had so many. Just patients coming up, giving me hugs, people who are appreciative. I just say when people are appreciative, that just makes me smile. I always tell people this. It's like you do things in life because you do them. If you're going to become a doctor, a dentist, a pharmacist, a PA assistant, you're doing it because that's who you are and that's what you love. You don't do it necessarily for the accolades and for the kudos. Just like when you open a door for somebody, you shouldn't expect a thank you. You're opening a door because that's out of your character and that's who you are. But when you get a thank you, especially in the healthcare field, it just kind of humbles you. And I think it just puts it in perspective of how lucky it is to be what you're doing. And you really feel grateful for the position that you're in. And sure, it feels nice that someone appreciates that. And that's the biggest thing. But for me, when I get those thank yous or a kid that comes to hugs me, I'm just like, hey, this kid is putting their trust in me. That parent is putting their trust in me to deliver the best care that I can. You can't beat that. I mean, if you have a kid one day, or if your parents out there and you know how hard it is to give your child to a provider and put your soul trust in him or her to take the best care of your child. And for me, that's the most rewarding part. And to me, that's, it really to me is I value the most is the fact that they trust me and they expect me to take care of their child. Do you have any advice for incoming undergrads interested in pediatric dentistry? For incoming undergrads, yeah, just dude, this is the best part. If I could go back and do undergrad differently, so my undergrad experience was awesome. I majored in I majored in biology. I did a minor in BA, business administration. Do a minor. do something that you think you're never going to be able to do. Because once you go into medicine, like it's eventually going to be your life. You're not going to be able to do the things that you were once able to do. So the best analogy I give is when we're in high school, we can all juggle 10 activities. Then you go to undergrad, you can probably juggle like maybe 5. Then you go to dental school or like med school, you're barely juggling like 2. So as life goes on, the responsibility kind of gets more and more weighted on your shoulders. So when you're an undergrad, just experience as much as you can, soak in the environment, live on campus and enjoy the experience of where you're at, major or minor in something that you haven't done, but is an interest and passion of yours. That's my biggest takeaway. Do something that you really want to do. Do extracurriculars that you really love and that you're really, like I said, it makes you happy. Because like, so once you get into med school, it does become very rigorous. And so your options become limited. Obviously, you're going to be spending a lot of time in the books and with clinical stuff. So in undergrad, use that time to develop yourself, find your why. You'll notice that's a very reoccurring theme here. But build your life resume in undergrad. How often have you dealt with difficult cases for children? Quite often, at least once a day. Severe difficult cases, maybe once a month, but it's definitely part of the field. How many patients do you see every day? So I'll treat about 10 to 15 in the chair, and then from a hygienist standpoint, I'll see about another 45 to 50. So anywhere in the ballpark of roughly about 60 to 65 patients a day. What is the general age range of your patients? That's a great question. So I'll see kids as young as, I would say, 10 days old. Actually, the youngest I've seen is 2 days old. A child who came in with a neonatal tooth that was in. It was fully cartilaginous, so it was made out of cartilage. It served no function, and it was very, very loose. So parents were worried, and the doctor was worried, the physician, that it'd be an aspiration risk. So I tried to take out that cartilage-based tooth. And some of our pediatric patients, or our patients who have cardiac issues or Down syndrome, I'll see a little bit longer. So I think the oldest patient I have in my chair right now is a 29-year-old. And usually I'll see those lifelong, just because of, with the MR, which stands for like mental retardation, which is the correct medical term. Those patients, because of their IQ and because of the ability, the way that they're functioning, I'll see them, lifelong in the dental chair. What are some common challenges, problems you see in pediatric dentistry? I think I addressed that in terms of parents. A lot of it's just behavioral issues with kids, kind of getting kids to understand and rationalizing with them. What interested you in peds? I talked about that earlier. I just don't want to beat the dead horse with some of these questions. So if I'm not answering them, I apologize, because I answered them earlier. Why I went into pediatric dentistry, I answered that earlier as well. What 2 words would you use to describe your job? That's a great one. Energy and love. I think are the 2 that I would describe for the job. What do I mean by academia? So I'm assuming this is in regards to me being in the academic setting. So academia entails working in a school setting. And that's kind of what I mean by being in academia. I teach part-time. And so that's kind of the academic setting that I'm in. What is the difference between pediatric dentist and a family dentist, which I touched base on? I'm sorry, odonogenic infection. Sorry, these are scrolling up on me. Have you ever had to collaborate with a medical doctor in order to solve a case? Yes. In residency, we had a case, something called hypophosphatasia, where a 3-year-old was losing their teeth very, very quickly, like randomly out of nowhere. The teeth just became loose and fell out. So in these cases, we will, send the kid to get lab work done. The lab work comes back and tells us about the phosphatase enzyme, and from there we're able to make a diagnosis. So I have done it in the past. Mainly, the biggest thing here in terms of collaboration with MDs is usually like education and just letting MDs know that, hey, if you have, with pediatric patients when they're first born, they have to see a physician or their primary care doctor within a couple of days of being born, which is mandatory. So my goal here with my PCPs in the area is just to let them know that, hey, I'm a dental provider and I like to see the children before the age of 1 and kind of build that rapport with them. So making sure that, hey, we're on the same page and making the pediatrician understand that, hey, as a pediatrician, as a pediatric dentist, our jobs go very hand in hand, and we want to work together to deliver the best and optimal care for and well-being of our patients. What was my favorite case? I think one of the ones I just presented on. was one of my favorites for sure. I had a couple other ones that are very similar, but just the empathy and the emotional drive behind that case really resonates with me a lot more than the other ones. Pros and cons of pediatric dentistry. Yeah, so pros are just being able to dress up, being goofy, releasing your inner child, and kind of loving what you do, bringing that love and energy each and every day, singing Frozen songs or singing songs, even if you have a terrible voice, it's the best part. Like, you can sing, and just be goofy and be yourself. The cons, yeah, having difficult children, sometimes parents are tough. And just, I think, I think the landscape in terms of, I guess the best way I'm trying to put this is like another con is just kind of is not maybe the field just not moving as fast as you kind of wanted to or where you wanted to see. Every pediatric dentist comes from a different, they've trained at a different place. So one of the biggest cons is like what I may do might very well differ than a colleague of mine. So there's not different ways to skin a cat in pediatric dentistry, which is not necessarily a bad thing, but it can make it a little bit more challenging, especially if you work in a multi-doctor office and there's Dr. X, Y, and Z, and a patient goes to Dr. X, and the next time they see Dr. Y, and the next time they see Dr. Z, you might get 3 different opinions. And so that can kind of sometimes be a continuity of care, especially in residency. To me, continuity of care is so important, making sure that, the child sees the same provider each and every time, but that's not necessarily feasible in residency, definitely not feasible in residency. And sometimes it's not feasible in private practice, especially if you're part of a multi-group with multiple doctors. That was a great question there. Is there a correlation between being tongue-tied or having a lisp, or is it completely unrelated? Great question. It can be and it cannot be. So sometimes lisps can be neurological in nature as well. Sometimes lips can be associated with the tongue tie as well. So I've seen them both ways. So it's a great question. There is not a true correlation in my opinion, however. My favorite procedure. Wow, that's a great question. I would have to say phoneectomies. It's just so life-altering and so life-changing. I just had a mom the other day with a 2-week-old last Thursday who I saw. Child could not feed, was having a very, very hard time latching onto the bottle. Mom was having a very difficult time breastfeeding. Did the procedure, and then just yesterday, mom called and said the baby kind of turned the corner and feeding has been going very, very well. And, to kind of help set a child up at that age for success, and for a new mom, not to feel guilty and not to feel that she should be ashamed of herself because, her baby's not thriving because of her. That's huge. It really takes a lot of weight off from a mom. And I always tell them it's not your fault, it's anatomy, but moms have a lot of self-guilt, especially first-time moms. I know with my wife and the way she felt with her first one and things that she wishes she could have done differently. And so I would never want to put, a mom in that situation. So I think helping those, first-time moms with their infants is definitely one of my favorite procedures and one of the most rewarding as well. Do you use a carbon laser or what type of laser do you use? Yeah, it's a great question. I use a diode. So it works on tissue contact. The best ones out there are also like CO2 lasers. I've used those. You don't need to be in contact with a tissue. You can just be a couple of millimeters away and it cuts. The diode, I love it. It does the same thing, but you have to be in tissue contact and it generates heat. And that heat is what causes kind of the tissue to ablate, get a little bit of tissue ablation. So that's kind of what I use for the phoneectomies. And can you please go over how I started my own practice? Great question. So I did not start my own practice. I actually have gone through 2 jobs. I'm on my third job right now. I was at a small family practice up in Scranton, which I thought would be a forever thing. Didn't work out. I joined a kind of a very big corporation, so to speak, in the Philadelphia area, and I realized that wasn't for me. It was just very heavy in terms of the Medicare, Medicaid population. I'm lucky I was able to treat those patients, but just kind of some of the ethics and things behind it just didn't really resonate with me. And so now I work in an area which I really love. I do see some of there's some of the sports players that bring their kids, so it's a nice balance. I'm really with the larger practice I used to see, I'd probably come home seeing 80 to 90 kids a day, and now I'm seeing about 60. And that 20, the difference of 20 is huge in terms of burnout. So even though I don't own my own practice, I am currently in the process of buying into this practice and becoming the clinical director for them, which I'm really looking forward to in terms of just having a new chance at doing something different. So I'll still be seeing patients, but I'll also be traveling to their offices that they have in Atlanta, in Georgia, in Florida, and Alabama, and just kind of standardizing the care in terms of from a clinical standpoint. So if there is a practice in Florida that wants to establish an oral sedation protocol, I'll be going in there and helping their doctors establish the oral sedation protocol as a clinical director. And so having that role and responsibility is something I'm very, very eager to in terms of my future growth and development personally and within the company as well. But if you are interested in starting your own practice, I did take a course on it. I'd be more than happy to help you with that answer. Just like I said, shoot me a DM. Any other specific question you guys have, shoot me a DM at the Superhero Dentist. I check my Instagram quite often, and I will get back to each and every one of you that message me. Last couple of questions here, guys. I think we're wrapping up. Is how has the pandemic affected your practice and job? Really, really good question. So I was unemployed for about 3 months. I was doing virtual or teledentistry. Very, very different than telemedicine. It's hard. Dentistry is very, very driven on tactile. So for me to see something, I really need to feel it and be able to see it. And that's kind of hard to do with, Google Duo or FaceTime. I think it was nice for patients to just have an understanding that, hey, like my dentist is there for me and for my child. So in terms of a psychological standpoint, I think it was very, very beneficial. But in terms of the actual procedure wise, it was very difficult. Now that we're back in work, with kind of the aerosolizations, we're at a very, very high risk. Dentists are just because of the proximity that we are with the mouth. But I'm wearing a full, almost like if you know Bane from the movie Batman, I have a respirator that looks just like that. A face shield. I wear my loops, gowns. I mean, we're gowned to the T. I probably feel more safer at work than I do going to a grocery store, just because of how well our PPE is. But also to kind of the patient flow. Our waiting rooms, and one of the things I really, really love about pediatric dentistry in our office is we have a pretty sick waiting room with arcade games and all this stuff that these kids can no longer utilize right now, just kind of with COVID. And so parents are driving in, they're texting us, everything's being done through text, limiting the inflow and outflow of parents that are coming in. So it's definitely changed the landscape a little bit. Something I'm not used to. I'm so used to having a waiting room full of kids, and just that's usually a great way for a lot of kids to be less anxious for their appointment. They're going playing the arcades, they kind of chill out. So now it's just that's not there. So it's just a little bit of challenges in its own way. It's a very, very good question there. Where do you see pediatric dentistry going in the future? That's awesome. So I definitely see from my perspective, I do see a lot more use of the laser. I see airway being a huge, huge, huge component in terms of dentistry in general, especially pediatric dentistry. Just kind of, our diet, what we're eating, how that's changing our landscape of the way our jaws are growing, in terms of our tongue position and airway and how all that factors into it. And then there's also some talks about, using lasers to cut teeth without getting a child numb. So I'm very interested in terms of how technology is going to aid dentistry. The one big thing here is unlike medicine, which you can have robots do surgeries, a lot of dentistry is empathy driven, and it's driven based on the human and emotional connection that you have with a child, especially pediatric dentistry. So I always say there's no robot that's going to come in and replace your job, because the empathy, that's one thing robots don't have, is empathy. And so in dentistry with the tactile, these little guys here are so important because they let you feel certain things. And so I don't know how much of robotics is really going to take over the field. I do see it for a lot of good reasons, but I don't ever see robots ever taking over our job, if that makes sense. What is your take on a gap year? Yes, I think I was talking to one of you before we even started this on this. Gap years are awesome. So my brother, who's a PM&R resident, I think he actually did one of these sessions a couple weeks back. He took 2 years off, and he absolutely he loved it. He did so much with his gap year. So I'm totally for gap years. I think the biggest thing here is just it's what you do with your gap year. And if you sit at home playing Xbox all day, that gap year is not going to help you. But if you, let's say, went to Cambodia and, did a outreach clinic out there, or just externship, or just travel the world and did something very unique or different. If you like research and you researched, you want to make yourself youthful. I want to see, usually if you take a gap year, you want to do something that's helping to build you grow. And I'm going to circle back to this again. building your life resume, right? Something that's really helped you kind of see things in a different life and give you a different talking point. Because that's what people are going to ask you is, hey, you can have a gap year, but they'll ask you, so what did you do on this time off? And you want to make that as, like I said, as rewarding for yourself as you possibly can. So gap years are great. I think a lot of times it helps people sit down, understand, and find their purpose in life, figure out what's your why. A lot of times you'll sit there and be like, you know what, maybe medicine is not for me. And that's huge. It's better than dropping, $100,000, $200,000 in the hole to realize that after your first year of medical school or dental school. It's better sometimes to do that during the gap year. So I'm a big fan of it, just to really use that time to your advantage. And I believe the last question we have here is, did you ever do research in undergrad or grad school? Yes. So I did do research in undergrad. I researched at 2 different labs in Penn. One was doing cell culturing with my principal investigator. And the other one was before I got to dental school was at the dental school. That was a really cool one where I would dissect mice, their femurs and their humerus. And we would do different analysis in terms of BMPs and some of these different proteins, and how, and one of them being a protein called noggin, and seeing how it affects, the effects of that in these fetal mice. And so I thought that was really, really cool. My always thing here with research is do it if you're interested. Don't do it for the publication or papers with the NIH. And if you're trying to get a grant, sometimes it's very, very difficult. Publications can also take multiple years with a lot of revisions, in writing a paper. So if you're going to do it, don't do it for the accolades. If you end up getting published, great. Like I was lucky enough to get published. It took about 2.5 years. It took a long time. But don't do it for the accolades. Do it because you're genuinely interested in research, and you just it's a passion of yours. And so those are kind of like my takeaways. But some really, really great questions, guys. Yeah, I love it. Like I said, if you guys have any more questions, feel free to reach out to me on Instagram. Like I said, at the Superhero Dentist. But this is great. Like I said, I hope it was added some value and kind of give you guys all a different perspective into dentistry. And just like I said, my big takeaway here is that teeth are important, but dentistry is just not all about the teeth. It's a whole bunch of things coming together.
All right. Thank you so much, Dr. Deep Shah. Your talk was amazing. I definitely learned a lot about pediatric dentistry that I didn't know about before. But yeah, so thank you so much. And for everyone else that's still watching, so the Google Forms will close at 10:25. So make sure you put in all your research points and answer the questions and fill out a summary on what you learned from the talk today. But yeah, thank you so much.
So welcome. You guys take care. Have a great night, guys.